So this is a brief voiceover to go over a little bit of preliminary information regarding immunizations and communicable diseases, those that are particular in infants and children. There are some learning outcomes. You can read through those should you desire to. But let's first talk about the difference between a communicable disease and an infectious disease. So a communicable disease is an infection that can occur from either a person or animal to another person via bodily fluids or via contact with a vector. And a vector would be either a surface or ticks or mosquitoes, et cetera, et cetera. An infectious disease is anything that is a communicable disease that is caused by a microorganism and is passed from one person or animal to another. So for a communicable disease to occur, three factors need to exist, and we just mentioned all of those: an infectious agent or a pathogen, a means of transmitting that infection or that disease, and a presence of some susceptible host that will be able to be affected by the disease. So there are risk factors that are associated with infants and children. And some of these you could probably almost estimate or hypothesize what would cause infants and children to be at a greater risk factor. First of all, as we know, newborns have an immature immune system. Infants do get some of the maternal antibodies passed to them, and of course those that are breastfed get that maternal antibody a little bit longer, but several months in after birth, we lose those maternal antibodies, and those children become much more susceptible to communicable diseases because they don't have a full or mature immune system at that point. Additionally, children have poor hygiene habits from time to time, and many of these communicable diseases are passed via fecal-oral route or respiratory routes. So Healthy People 2020 said that we overall need to decrease the number of preventable childhood illnesses. And interestingly, about 300 children die every year from a preventable, vaccine-preventable disease. And of course, we all at Temple don't need to be reminded of the need for vaccines after our month's outbreak. The way we can prevent the spread of infectious disease, this should all be pure review for everybody. Good hand washing right at the top of the list. We need to teach it. We need to teach young children and families and caregivers proper hand washing technique. Standard precautions for all patients, avoiding and sort of separating those who have been exposed to infections. Really work to get families to immunize, and in class we'll be talking a lot more about how to discuss that and work with families who are having a difficult time with that. We need to educate. First and foremost, I guess, beyond hand washing is really educate people and help them understand these communicable diseases. In many cases, some of what we're vaccinating for, some people have never seen before, and they're feeling like, well, we haven't seen it, we don't need vaccinated. And in reality, the reason you haven't seen it is because we are vaccinated. So we'll talk about that. The last few things I just want to mention here is that there are some common methods of caring for children who do have a communicable disease. So these are some overarching things to think about when caring for them. Number one, in terms of what we would assess, most often we will see things like fever, which can affect hydration status of children very, very rapidly. So vital signs need to be monitored very closely. Some of these communicable diseases that we'll talk about can have a lot of itching and skin issues, so we really do need to think about comfort level and working with comfort level, especially around rashes. And then, of course, with all of them, we need to watch that we haven't developed a toxic appearance, which would be poor cardiovascular and respiratory function. So some nursing diagnoses, you can imagine skin integrity issues, deficient fluid volume, fever, oral mucous membrane. Some of the communicable diseases we're going to talk about involve ulcers in the mouth, so we may need to do some treatment regarding that. Pain management could be here as well. So some things that we will do, first of all, most of these children will be cared for at home unless they are really showing signs of a toxic response. We will isolate them, and we have to also think about who else may be in the home that could be exposed and how to protect, and that takes us back to our education, standard precautions, and hand washing. Toys. need to be wiped down. Daycare centers need to remember this because some of these diseases can go very quickly through a daycare center because of how well they're taking care of what needs to be taken care of in terms of toys and whatnot. We need to treat fever, we need to improve hydration status, and we really need to involve the parents, obviously, developmentally, very important. So some things that I do just want to mention here is that itching is associated with a lot of the diseases we're going to talk about. And for children, it's very hard for some children to avoid itching. It's hard for us as adults to do that. So one of the things we'll first do is actually cut the fingernails so that they don't have as an effective a scratch. We can use certain tepid or like oatmeal baths that can be somewhat soothing to the skin. We can medicate with antihistamines if that is helpful. Distraction and some of the other techniques we will talk about in pain management may be helpful for some of the itching management as well. And finally, our evaluation is going to be based on, did we prevent a spread of infection? Are they taking all of the antibiotics if they are ordered properly? Is their fever effectively managed, as well as are they hydrated well? And did we get them to an improvement status without the spread of that infection?